All right, good afternoon. We are here for our daily briefing. Of course, just as a heads up, we're going to not do this on Sundays unless there's something very, very urgent to that specific day. So 6 days a week, 11:30 each day, we'll continue this. As also has been our format, we're going to feature a couple of folks to give specific updates, including today we're joined by our Council President, Pat Davis, also by our Deputy Chief of Police, Harold Medina, and also by our Deputy Fire Chief, Emily Jaramillo, and by our Emergency Operations Center Director, Roger Ebner. And so we're going to hear from them today. So a couple of updates from Central New Mexico as a whole as we start off today. Presbyterian, their testing site hours are changing. So due to high winds, the Presbyterian site is changing their hours today from 9 a.m. to 3 p.m. And Sunday, March 28th, they're going to be closed. But beginning Monday, March 30th, they will operate the testing site Monday through Friday from 9 to 5. Also, to reiterate a couple of things from yesterday, the governor has issued an executive order requiring travelers to New Mexico to self-isolate for 14 days to help combat the spread of COVID-19. I think we've all heard about that. And if you have questions, please reach out to the governor's office. Also, for our surrounding outdoors folks, I know the mountains have been very busy. I've actually been trying to do some hiking with my kids on Sundays, and all our different facilities are being heavily used in a great socially distanced way. In that spirit, we do have an update from Cibola National Forest and Grasslands that they are limiting visitor services at developed recreation sites during the current public health crisis. And so you can go to their website to find out details, but a lot of the things like bathrooms and so forth are closed as they limit those services. Okay, APS also, of course, yesterday announced that the rest of the school year is going to be closed, but that there is going to be learning from home plans that are going to be rolled out over the next few weeks. And so stay tuned for what's going to happen on that. And the New Mexico Supreme Court announced that they will be suspending in-person CYFD family visits for 30 days in response, again, to the COVID-19 outbreak. Now, with respect to government continuity, we're going to touch on this, I think, in some little bit more detail when our Council President, Pat Davis, speaks. But I want to mention city boards and commissions. We are working on a way to make sure that we can follow the Open Meetings Act and also include public comment for all our boards and commissions. So the city clerk has been charged with this effort, and stay tuned this week. We hope to announce guidelines for all city boards and commissions so that they can operate in the time of physical distancing and so forth, and still honor the concept of public comment. So the details aren't ready yet, but stay tuned this week for details on how and if we're going to be able to do that for the next 30 days. Also, some updates on city services. We do have a large RFP out to try and really resuscitate Route 66. And this is a $500,000 investment in marketing and promotion for Albuquerque's Central Avenue. And it is related to the art project. This is something, as we think about recovery, that the timing couldn't be better, really. And it's also something our council president's been working on, and he'll share a little bit more information on that as well. Now, also, I want to mention that we are doing construction on the art route, and so we're trying to do as much construction as we can while traffic is light. And so you might see that all over town, but we're certainly starting with adding pin curbs up and down Central to increase safety for when the art route is up and running again. And we're mentioning that to you today also to remind everyone that as of today, the art route is currently on hold for the next few weeks in foreseeable corona future. And when it comes back, we'll have these new pin curbs in place and hopefully a much safer route for pedestrians and for traffic. Now, we also are working with our partners at APS on what we're going to be able to do with respect to learning from home. This is another thing that this week, hopefully, we're going to be able to finalize and roll out. We're trying to use city resources in different ways to provide internet access to folks that don't have it at home. So we'll see how this is going to work this week, but we're trying to utilize some of our vehicles, including our Sun vans that have internet nodes, and also kind of cranking up the internet at our community centers so that people can use that internet in a parking lot for free. So the concept is drive up wireless. And again, this is a work in progress. We hope to announce more details on that this week, and also with our partners at APS. All right, so I think what we're going to do to begin with is talk a little bit about our Emergency Operations Center. And I think people have been hearing a lot about what this is. I do want to mention it's an actual physical building out on the west side in Councilor Pena's district. And it's a tremendous facility that we built coming out of 9/11. And since that time, roughly, our city, as a major city in America, has had an emergency operations director and also department, and again, facility. This is the first time we've used it in every sense of the word, Emergency Operations Center. Now, it regularly trains and prepares for activities. The most recent one that has been relevant, of course, was the anthrax training that they went through earlier last year. And this is, a lot of people ask us, how can we scale up? What's the city doing to get ready for X, Y, and Z? We're very fortunate to have actually someone thinking about that and working through those as their full-time job. And he's a person who rarely sees the public spotlight because we haven't had a lot of reasons to declare an emergency. But right now he's front and center at the city of Albuquerque. So I want to introduce Roger Ebner to talk about what the center was up to last week. Thanks.
Thank you, Mayor. The Emergency Operations Center, or EOC, is a city facility where we can centralize all activities related to responding and recovering from any threat or hazard that we may face. The high-level focus or functions in the EOC are overall interagency planning internally within city agencies, externally across the city with our local partners, as well as our state and federal partners. We also provide information management and situation awareness about the incident and all activities by all involved organizations. One of the more difficult things during an emergency is ensuring that everyone has the same accurate and timely information. Also planning for immediate needs and advanced planning for potential needs in the future. Resource management, which is the acquiring, tracking, and the allocation of supplies. And finally, financial tracking and analysis of city expenditures. Our city EOC was formally activated on March 12th, but we were engaged as a city for many weeks prior as we prepared for this pandemic. Since activating, we have had people at the EOC working up to 12-hour daily shifts. The number of people at the EOC fluctuates between 15 and 25 people. We have some there full-time, some part-time, and some are working on a virtual basis to reduce the potential contagion. We have people at the EOC focusing on the following areas: transportation, mass care and human services, resource management, medical services, law enforcement, finances, also volunteer management, also continuity of city services, communications, public health, and access and functional needs to ensure equity and inclusion for every resident of the city who may need emergency services and/or information. Over the past few weeks, we have fielded many calls for assistance, for supplies, information, and other services. We have coordinated or assisted with food acquisition at various sites with some of our local partners. We have secured volunteers to help at food distribution sites as well as other sites. We have distributed thousands of goggles, gowns, and gloves to our local healthcare partners. And we've also distributed over 40,000 protective masks to local hospitals, testing sites, first responders, and other healthcare providers. We've also helped to coordinate the public messaging and COVID-19 fact sheets for everyone into various languages, including Spanish, Farsi, Swahili, and Arabic. So the EOC will continue to operate as long as is necessary and scale personnel up or down as needed to provide essential coordination services throughout the pandemic. Thank you.
Thank you so much, Director Ebner, and our city very fortunate to have you during these tough times. Next, we're going to hear a little bit of an update from our Albuquerque Police Department and what's occurring on the streets with our Deputy Chief of Field Operations. That would be essentially all the officers out on patrol and a couple of other specialized units. Deputy Chief Medina. Chief.
Thank you, Mayor. I just wanted to update the public on the actions of the Albuquerque Police Department and what we're focusing on. We're focusing on 4 key areas, the first being our continued support to the community in response and being able to provide services. We've made several adjustments in increasing the amount of reports that we could take over the telephone, and I'd like to thank the public for being patient and understand during this time as we made these changes. We still have all of our officers out in the field. We also have a group of officers that we've designated for special events or special conditions. We used these officers recently to help be a visible presence at some of our big box stores during the recent weeks when we had large amounts of shoppers in the area. The second area that we're concerned about is we have been focused on ensuring that we still have crime control measures in place and that we're still out and our officers are addressing the crime issue that has plagued Albuquerque for the past several years. Our officers are out there, we're getting daily updates. Currently, I can say that we have seen an increase in commercial burglaries and an increase in auto theft, and we are making adjustments as a department to address these issues, and we'll continue to make adjustments to be proactive and to ensure that we continue to keep the community safe. The third area that we're focusing on is the safety of our officers. We've paired our officers up to make sure that they have a consistent partner each day of the week, week in and week out during this epidemic or pandemic, so we could make sure that if an officer gets sick, that not the whole squad is sick and that we don't start losing mass amounts of officers. We're working very hard to make sure that our officers have all the equipment that they need to stay safe, and we're also making sure that they're giving you ideas and techniques such as taking more telephone reports over the telephone and also asking individuals to come outside and deal with them in the open air along with all the protective equipment. The last area that we're focusing on is we're also focusing on being an assistant to New Mexico State Police. Our officers are not citing, they're not pulling people over for the sole purpose of reminding them of the order to stay home. They're simply out and about giving verbal warnings if it's appropriate, and when they see groups of individuals gathered in large groups, they will ask them to disperse and to maintain the 6-foot distance. I'd like to close by just thanking the men and women of the Albuquerque Police Department, both sworn and civilian, for their dedication to our city. Our officers are out there every day for the first time facing an invisible threat, and this invisible threat is real for them, and they're out there doing everything they can to keep the citizens of the city of Albuquerque, and I'm very proud of how these officers have worked over the past few weeks, the long hours they have worked and the conditions that they're working in. Thank you, Albuquerque.
Thank you very much, Chief. Next up, I want to also invite our Albuquerque Fire Rescue Department Deputy Chief Emily Armijo up. She's in charge of a lot of things, but especially our program that works the HEART and BLS programs that deals with a lot of down and out and mental and behavioral health situations. Deputy Chief.
All right, excuse me. Good morning, everybody. I'd like to start with we work with our medical director, Dr. Kimberly Pruitt. She oversees all of our emergency medical services, and I have a few talking points about just general healthcare information about COVID-19 and some information about calling 911 to start with. So, about 85% of the patients that are contracting COVID-19 virus will suffer from mild illness and recover without any need for medical care at a hospital. So we think that number is important to understand that it is a virus, but we also want to make sure that we don't negate the fact that COVID-19 is a new virus, it's serious, and that it is very, very important to follow the directives from the New Mexico Department of Health and the Governor's Office related to social distancing, staying home, washing your hands, paying attention to hygiene, things like that. Individuals that are at highest risk are people that have underlying lung and heart disease, diabetes, and our elderly. So it's very important if you have loved ones that fall into that category, that part of your social distancing is not physically interacting with those loved ones, which we all understand is very hard. Myself, my kids haven't seen their grandma since January, but these are the things that we need to do to protect our loved ones from getting ill. It appears that the virus can survive on surfaces, so things like your phone, door handles, when you pump gas at the gas station, things that we might not think about as something that might carry a virus. It appears that it is living on surfaces for about 3 to 4 days. So you can protect yourself and your at-risk family members by hand washing, using hand sanitizer, staying home if you're sick, staying home if you're well because we're social distancing, covering your cough, and cleaning the surfaces in your home with any of the recommended cleaners that they have. We cannot emphasize that enough to increase just our general well-being during this time. The virus is also spread by respiratory droplets through your nose, eyes, and mouth. So encouraging family members not to touch their face can help with that as well. As a city, it's important that we consider the healthcare system as a whole, so not just our 911 response, but also consider the capacities that our hospitals have to address sick patients with COVID-19. And so as part of that, we are encouraging citizens to only use 911 for true emergencies. If you have flu-like illness with a fever and a cough, no shortness of breath, we're encouraging you to call the New Mexico Department of Health hotline, 1-855-600-3453 for guidance. First responders and EMS and hospital resources are tight. So please only call 911 if you feel like you need medical interventions like oxygen for shortness of breath, things like that. There is no treatment for COVID-19 in the hospital. So if you call 911, use an ambulance, go to the hospital for fever and cough, there is no treatment for that. They're likely going to send you home and have you perform self-care at home. With the limited space in hospital ERs and ICUs, we need to save these beds for people with serious medical conditions. You also don't want to expose yourself unnecessarily to the virus by going in for something that doesn't need to be addressed in a hospital. Albuquerque Fire Rescue implemented dispatch screening in January. So we've been doing this for several months where anyone that calls 911 gets asked if they have a fever or a cough. We're doing this to notify our crews in advance that they need to don the appropriate protective gear before making patient contact. Part of that is we've also changed our operations to send one firefighter in to check the patient initially, and then determine how many firefighters need to be on scene to provide assessment and treatment with that patient. These are in an effort to conserve the PPE that we do have, because this really is our lifeline to protect our firefighters to stay healthy, to provide 911 service to the community. Also with that, if you call 911, you will also be asked by our dispatchers to meet our crews outside if at all possible. This further reduces the exposure to firefighters, so that's another thing that we implemented. And then lastly, we started today we re-scoped our HEART team and our BLS rescues to help address the COVID-19 outbreak. So our personnel from those divisions, as well as our other support divisions that aren't so busy right now, because of the change in duties, will be responding. We have two rescue units that will be responding to calls that have a high index of suspicion for COVID-19. And so we'll have those two trucks 24/7, as long as we need them, responding to those calls. The last thing that Albuquerque Fire would like to remind everybody is we know that these are kind of scary times for the public. We want you to remember that it's very important that you take care of yourself and your family to keep your immune system up. So the better your overall health is, the better it will be if you do get sick. So follow the social distancing guidelines, maintain mental and physical health when you're staying at home. So stay hydrated, eat a balanced diet, try to get enough sleep, get your kids outside, go for walks, play in the backyard, get sunshine, things like that. And then lastly, just to reiterate what Chief Medina said, we just want to thank all of our firefighters, both our civilian staff and our sworn members. They've really stepped up to the task. They come to work every day. It's kind of an unknown thing that they're going into, but they're here to serve, and we really appreciate them. And if you can just assist by staying home, you're going to keep our police, you're going to keep our firefighters healthy so that they can provide 911 services for you. Thank you.
Thank you so much, Deputy Chief, and again, appreciate all the folks both at APD and AFR and all the employees of the City of Albuquerque who are working during these tough times. And so far, just doing an outstanding job stepping up for one Albuquerque. As we talk about continuity of government and other leaders in our city, I want to ask our City Council President, Pat Davis, to share a few thoughts, and also want to thank them for their hard work, especially everything they've done with respect to continuing government, but also under the auspice of what is a public health emergency. And so we're fortunate to have his leadership at this time. City Council President Pat Davis.
Mayor, thanks so much, and thanks to Roger and Chief Medina, Chief Armillo. We appreciate all of your work. I just want to share a few minutes, as the mayor said, as the city is sort of moving and working through sort of the day-to-day triage and adjustment of city services to respond. We're also starting to look ahead in terms of long-term planning for the city and what this means for long-term budget impacts, long-term services impacts, and how we start to recover the city of planning for the recovery after the crisis and the emergency is done. As the mayor mentioned, we've worked really hard with the administration in the last few weeks to fast-track things like the $500,000 marketing grant for central small businesses to ensure that when those businesses are coming back, the city can be a good partner in bringing customers back, getting factual information, and fast-tracking our recovery as quickly as possible. But councilors have also been involved throughout the last few weeks with the administration, and I want to highlight some of those things that our councilors have been doing with their community to say thank you. Some of you may have seen Councilor Benton was working with our neighborhoods in the Kirtland Annex and in South San Jose neighborhood last week with the administration as a liaison to figure out how to adjust with the neighborhood to help support the opening of those community centers as extra shelters for our most at-risk homeless and unhoused population. Councilor Gibson earlier this week had a virtual town hall with neighborhood residents and community providers to ask and answer questions about how the city could respond and to start being a liaison with those groups. She also did a call with the Agora Crisis Hotline, the Suicide 768 helpline that's helping those in need, whether it's referring to for suicide or mental health and behavioral health issues, to helping to find housing solutions for those in need. Councilor Gibson did a great call with them and provided some meals for those workers who are working overtime right now to provide those services. Our new councilor, Councilor Senna, visited our AFR stations on the west side last week, took donuts and treats and visited with them about how they're responding and adapting. And so our councilors are working all across the city. Looking ahead, we're already meeting, began those conversations last week with the administration to look at how we can plan for the city's budget in the next year, in addition to how we can watch the federal response and engage and be sure that we're putting those resources together. To that end, I really want to say thank you to our federal delegation. Folks like Senator Martin Heinrich and Tom Udall deserve our thanks, and for those of you at home, can log in online on their Facebook or send them a quick message. They have worked overtime in the last few weeks to ensure that cities like ours had the resources we need to respond. Congresswoman Deb Haaland flew overnight back to D.C. to be sure they had a quorum to get that bill passed on Friday, subjecting herself to a new quarantine when she comes back to New Mexico, all to be sure that we had what we need, and we want to say thank you. And I want to say thank you to the mayor, who's been inviting councilors starting this week to go visit with him to some of our community providers and situations to see how that's working firsthand. And so looking ahead, we're looking at how the city council is trying to take a lead on how we start to plan for our recovery, and beginning with that at our April 6th city council meeting, assuming we don't need any before then. as the mayor said, we're working on ensuring that not only that we have the counselors there to do the city's business, but that we can find even better and more robust ways to include in-person public comment or live public comment by telephone or computer or other ways to ensure that everybody gets a chance to participate and share their concerns. And so we're looking ahead for that city council meeting to do budget updates and to do the city's business to be sure bills get paid, that grants are being received, and that we have an update on sort of how we can interact with the feds. And so I want to thank the mayor and his administration in particular for including counselors in that and for working together on these planning processes. We're starting to move and transition into that long-term planning, and I think that's a good sign for our city. That we're already thinking ahead, months ahead, about what this looks like for the rest of us. So thank you very much, Mayor. We appreciate it.
Thanks. Thank you. Okay, thank you so much, President Davis. And we're truly working on that one Albuquerque spirit. I think all across our town, whether it's how we're dealing with our own personal interactions at the grocery store with our families, but also, as you can see, whether it's Bernalillo County or APS, council and the administration, right now we have a wonderful sense of unity and alignment. That includes the state of New Mexico and the governor as well, and our federal delegation. What they did pass, we had an update on yesterday with respect to the numbers, so we can make our CFO available to folks who have questions on that. But again, actually see yesterday's briefing for how that affects the city of Albuquerque, and also as an expression of gratitude for the support we're going to get. Thank you to our delegation for making that happen. Okay, a couple of other final things before we wrap up here today. Specific ways to help. Right now, our police department is still in need of all sorts of types of support, and we're coordinating donations. If you would like to help our police department out, you can donate to the APD Chaplains Fund. And the information on that you can obtain by calling during business hours, 768-2131, and those dollars go to all sorts of things, from supporting families who do have to self-quarantine because they may have been exposed or not. It also goes to things like helping recruiting, which is something that we need to continue to keep doing even despite Corona. Now, our myth busting today is really about this notion of curing the coronavirus, and I'm glad Deputy Chief Armijo mentioned this. Like the common cold, or even many times when you get the flu, it's not like there's that much different at the hospital other than extreme situations where a ventilator is required. It's pretty much about rest and staying home and taking care of yourself. And so we do want to debunk the myth that somehow if you can just get to a hospital, Corona will go away or you'll get better. Unfortunately, that's not true right now anywhere. And that's also what makes this so dangerous, but also why it's important for folks to remember to really just call that NMDOH hotline, and they will talk you through the medical realities of Corona. Lastly, we always like to touch on takeout. Takeout yesterday was Roma Bakery. Thank you so much, Roma. And with that, we're going to be here for your questions. Questions for any of our presenters at this time. And I think we'll do in person first. Jesse?
Just a quick timeline on the ARPA stuff. Did you have a specific date when they'll be running again, or just kind of waiting out to see how that goes?
Right now, it's a wait and see approach. We know that it'll definitely not be running for the next 2 weeks, and we suspect longer. So our sort of guidance is 30 days, but we'll evaluate it every 2 weeks and give you a rolling 2-week deadline. All right. Okay, well, thank you very much. We will see you Monday. Thank you.
Good job. That's an old one.